Welcome everybody to MoRat Nation. I'm Bob Carmichael and let's get started. To begin with, I should mention that I am not a doctor and these are my personal views and are not intended as medical advice. Testosterone or testosterone replacement therapy for anti-aging and longevity. The 4 big reasons I use testosterone therapy for aging include managing senescent cells, managing ferritin and iron levels, managing estrogen levels, managing frailty such as osteoporosis and sarcopenia, managing senescent cells or zombie cells. Our thymus gland slows down in our 40s and turns into fat in our 50s. And when that happens, our immune system stops cleaning up these zombie cells in our 60s and 70s until diseases such as essential tremor, Parkinson's disease, and AFib begin to develop. I talk about why these 3 diseases are similar in this video. There are a number of clinical trials to overcome this problem, such as vaccines to help the immune system kill senescent cells. This is Dr. Greg Fahey's clinical trial to rejuvenate the thymus gland using growth hormone. Senolytics and xenomorphic drugs to kill or rejuvenate these zombie cells. Rapamycin and the rapalogs, drugs similar to rapamycin, are the great hope of the longevity and anti-aging community. This Pearl trial hopefully will allow rapamycin to get out of the laboratory and into the clinic. But I do not intend to use rapamycin because of the study that came out recently. I talk about this study in my latest video, where the TREM2 gene is prevented from being upregulated by rapamycin. This is a clinical trial using dasatinib plus quercetin. Dasatinib is a chemotherapy drug, and quercetin is an over-the-counter supplement that you can find in most health food stores. I certainly hope we don't go down this road. Didn't we try this with cancer without success? I think peptides like FOXO4-DRI will someday be the treatment of the future. In this clinical trial, they are trying to rejuvenate Leydig cells in mice. If this approach is successful, someday we may not need to use testosterone replacement therapy. Therapeutic plasma exchange, or TPE. This is an FDA-approved medical procedure where they take all of the plasma out of your blood and replace it with saline and albumin. The good people at Global Apheresis near San Francisco are putting together a clinical trial to show whether this approach will effectively get rid of senescent cells. I would use this approach, except that it costs $5,000 per procedure, which is a little bit out of my comfort range. So what did I decide to do? Since TPEs is so expensive, I decided to donate blood 6 times a year. Why this approach? Blood donation is a safe and free way of lowering senescent cell levels. It's government supported and good for my community. But where does testosterone fit into this protocol? When you donate blood 6 times a year, your blood cell count and your hemoglobin tend to drop each time you donate. You cannot donate when hemoglobin levels drop below 13. You can supplement with vitamin B12, vitamin C, and iron, but this will probably not be enough to raise hemoglobin. The only dependable way to raise hemoglobin is supplemental testosterone. Supplementing testosterone causes a condition called secondary erythrocytosis, where EPO levels in the body are adjusted to a higher level. So what is EPO? Erythropoietin, or EPO, is a hormone produced in the kidneys that stimulates bone marrow production of red blood cells. What raises EPO? When oxygen sensors, or repos, in the kidneys notice drops in oxygen, additional EPO is released. What causes this effect besides testosterone? Holding your breath. untreated sleep apnea, living at high altitude. These are all normal and reset our EPO set point. Doctors become concerned when hemoglobin goes above 17. The risk for strokes and heart attacks increase when our blood becomes this thick. But with 6 blood donations a year, risks actually decline. EPO is good for you. EPO is a nootropic or smart drug. In high amounts, it will keep your mind sharp, but EPO is a large molecule and has trouble getting past the blood-brain barrier. A peptide made from EPO, ARA290, is now in clinical trials to treat small fiber neuropathy. If you are a woman or a man that does not want to take testosterone, there are a variety of supplements that are advertised as being able to raise EPO. Changing the way you take testosterone can raise or reduce the amount of EPO that is released. Taking a daily cream or insulin needle of testosterone will cause a much lower EPO release than a weekly injection. Iron management. It is almost impossible to live in an extended lifespan without carefully managing iron. All-cause mortality rises as ferritin, a measure of iron storage, rises. Senescent cells contain 10 times more iron than healthy cells. High iron levels can also lead to higher amounts of lipofuscin in cells. Iron is regulated in the body by a liver hormone called hepcidin. When hepcidin level is high, iron from diet sources are reduced. Things that raise hepcidin: fasting and calorie restriction, hard exercise, several supplements such as quercetin from onions, EGCG from tea, and IP6. Things that lower hepcidin: testosterone, growth hormone, and most other anabolic hormones. So why do you supplement these anabolics if they raise iron? If you donate blood 6 times a year, you lose 30 to 50 nanograms per milliliter of ferritin per donation. It doesn't take long before you become iron deficient. Men who donate blood 6 times a year commonly have ferritin levels below 20 nanograms per milliliter, a dangerously low level. Anabolic hormones like testosterone and growth hormone can lower hepcidin to levels that will allow your duodenum to absorb iron and return ferritin to safer levels. Otherwise, hepcidin will block dietary sources of iron and heme iron supplements in the duodenum, the first part of your small intestine. Estrogen management. Estrogen is not bad for you. Men need a certain amount of estrogen to live a healthy life. When we talk about testosterone replacement, we are only talking about estradiol. Men do not make estradiol. The aromatase enzyme converts testosterone into estradiol. Men with low testosterone are at high risk of developing osteopenia and osteoporosis. The first thing people try when they are told they have a bone density problem is to add calcium to their diet. But a better choice is to correct the estradiol deficiency and increase vitamin D3 and vitamin K2. Adding calcium without vitamin K2 will only result in lining veins and arteries with calcium. I go into much more detail about bone loss and osteoporosis in this video. Testosterone by itself can improve bone density, but a metabolite of estradiol does most of the heavy lifting. Men with high levels of testosterone can still get osteoporosis if they use an aromatase inhibitor to prevent the conversion of testosterone to estradiol. In a man's body, testosterone is regulated in the brain by measuring estrogen levels. When estrogen levels drop, the brain responds by sending hormone signals, luteinizing hormone or follicle-stimulating hormone, to the gonads to increase testosterone. In older men, this causes a problem. If estrogen levels drop, and if the same amount of estradiol is converted, the brain does not know about the imbalance. This is why many older men have higher estrogen levels than their wives. Testosterone replacement can restore this natural balance. Longevity and life extension levels of testosterone. Only levels below 200 milligrams per week are used. Too high estrogen levels are unlikely at these modest levels. If the estrogen to testosterone ratio is still out of balance, try adding 25 milligrams per day of zinc, a mild aromatase inhibitor. But be careful with zinc. I more than doubled my dihydrotestosterone, or DHT, levels in just 1 month with this combination of zinc and magnesium. This can cause a lot of unpleasant side effects. The other reason to want a healthy level of estradiol. Libido and erectile function are both improved by a normal healthy balance between estradiol and testosterone. The risk of various heart problems declines when estradiol is neither too high or too low. Estrogen for skin. Estrogen slows the decline of skin collagen. Estrogen keeps hyaluronic acid at youthful levels. Estrogen aids in wound healing and wrinkle prevention. Managing mood and depression. At least 1/3 of men over the age of 50 have low natural levels of testosterone, below 400 nanograms per deciliter. It's common to see men with low levels of testosterone reacting emotionally in two different ways. If the man's estradiol levels remain high, he will tend to become angry and hard to get along with. If the man's estradiol levels drop, he will tend to become depressed and anxious. Unfortunately, men are often prescribed various types of antidepressants without taking into account their declining hormone levels. This is also true of women. It can take as long as a month after starting testosterone therapy to see a change in a person's mood depending on what form they use. Injections are usually much faster acting than other methods. The way most people think about testosterone is a way to put on additional muscle or as a sex aid to increase libido or erection. The only time people connect testosterone with mood or behavior is when they talk about roid rage. Roid rage is caused by using too much testosterone or some other steroid that ends up causing sky-high levels of estradiol. Estradiol is what causes roid rage, not testosterone. Without a normal level of testosterone, most men would suffer the same symptoms that women experience during menopause. The main difference would be that it would happen gradually over a number of years. Frailty, or sarcopenia and osteopenia. Sarcopenia is an aging process where motor neurons begin to die. This causes the muscle fiber they control to atrophy. Sarcopenia can and must be avoided in order to have a long and extended lifespan. The other big cause of frailty in the elderly is bone loss, osteoporosis, and osteopenia. Bone loss can also be avoided with proper diet, exercise, and nutritional supplements. Testosterone and growth hormone drop to very low levels by the time we reach 65. We can hang on to our remaining muscle and bone with proper nutrition and exercise. But it is very hard to increase muscle mass or to restore bone loss without at least some hormone supplementation. Testosterone and growth hormone, and to some extent estrogen, but just raising hormone levels is not enough. Eating a diet with enough protein for muscle growth, 1 gram of protein per kilogram of body weight is usually required. Also, there is a wide array of supplements such as creatine monohydrate that can be tried to improve results. In addition, the proper form of weightlifting should be used. Do not use free weights, such as barbells and dumbbells. Use machines that protect you from injury and do not use full range of motion. Exercise only in your strongest range of motion and use enough weight to only allow you to do 2 sets of 8 reps. Do no more than 7 or 8 exercises per day and no more than 3 times per week. Do not overtrain. The older you get, the longer it takes your body to recover. I'm just about finished with 2 safe weightlifting videos that will demonstrate the exercises you need and what machines you should use. So be sure to subscribe to Mole Rat Nation so that you'll be notified when these videos are finished. Testosterone risks and side effects. Many doctors view testosterone the same way they view plastic surgery. It's medical, but not really that necessary for good health. Doctors are watched to make sure they are not prescribing testosterone in an unsafe amount or for inappropriate reasons, such as for high school athletes. Testosterone can have a number of dangerous side effects. Some studies show an increased risk of heart disease and stroke. Donating blood 6 times a year greatly reduces this risk. All steroids put a heavy load on your kidneys. A good doctor will check your creatinine and GFR levels to make sure your body can handle the dose you are on. If you lift weights, your creatinine levels will be higher than normal. You should ask your doctor for a cystatin C test instead of the standard creatinine test that is used to estimate kidney filtration rates on the standard panel. It's a much more accurate way of measuring GFR. The reason most men don't do TRT is the risk of prostate cancer. If you have an old doctor, he was taught that high testosterone causes prostate cancer, low testosterone will protect you from prostate cancer, and giving testosterone to a man with prostate cancer is like throwing gas on a fire. Surprisingly, none of these statements today are considered true. The other 2 side effects that men worry about, BPH or enlarged prostate, and hair loss. Enlarged prostate. The number 1 cause is not testosterone, but insulin. If you have high insulin, the most important step in reducing BPH is to lower insulin levels. No sugar or grain products, and no low-fat dairy, only high-fat dairy. There are drugs like finasteride and supplements like saw palmetto that lower DHT. They can help with symptoms by blocking the 5-alpha reductase enzyme that converts testosterone to DHT, or dihydrotestosterone. Hair loss and male pattern baldness. Men have androgens that are released from sweat glands on top of their head that attach to hair follicles. These androgens, usually testosterone and DHT, can cause low levels of inflammation, which the immune system mistakes for infection. The more androgen receptors on the hair follicles, the greater the chance of hair loss. This is why some men are more susceptible genetically to hair loss than others. The best way to inject testosterone. Testosterone is available in many forms, such as creams, injections, and gels. This video only focuses on the best way to inject testosterone. Most injection vials contain 100 or 200 milligrams of testosterone per milliliter in an oil base. The most common way to inject testosterone is to use a large gauge needle, usually 20 to 25 gauge and at least a half an inch long. It's like sticking a harpoon in your leg. Usually testosterone is injected once a week or once every other week. The most common amounts used are from 100 milligrams to 200 milligrams per week injected into a large muscle. The most common place to inject 1 milliliter of testosterone is into your thigh muscle or your butt muscle. The problem with using this method is that your testosterone levels are too high for the first part of the week and too low for the second part of the week. This can cause your hemoglobin and hematocrit to spike during the first part of the week, and then your testosterone levels are too low during the last part of the week. Also, using a needle that large injected into a muscle will cause a large sore spot on your leg. I find it much easier to use an insulin needle, usually 30 or 31 gauge by 5/16 long, every day to inject subcutaneously into the fat layer around my stomach. If I'm careful, I can usually avoid the sore spot that comes from using the big needle. This method also avoids having big spikes in hemoglobin and hematocrit. Every 10 days, I fill up a package full of insulin needles and put them in my desk drawer next to my chair. Testosterone comes in an oil base, so it is very hard to fill a syringe. I usually pump a milliliter of air into the vial to make it easier to fill a syringe with the testosterone. If I want 100 milligrams per week, I divide that by 7, which gives me a little more than 14 milligrams per day. Or I can divide the dose by 3 if I work out 3 times a week, and take testosterone on the days I work out. I go into more detail about how to use insulin needles and how to figure the dose in this video. Insulin needles usually have 30 to 100 tick marks on the side of the barrel. Each tick mark represents 1 milligram of testosterone if the vial has 100 milligrams per milliliter, or 2 milligrams per tick mark if the vial has 200 milligrams per milliliter. I plan on making several other videos about this subject, including one about natural ways to raise testosterone, which I do not think are a good idea. So please click on the playlist at the end of this video and subscribe to Mole Rat Nation. I have no financial ties with any of the products mentioned in this video. And thanks for watching.